Good morning, viewers. As a package of molecular oncology, I have delivered a lecture, a concept of molecular oncology. Second, in that connection, the concept of cell signaling. And the third chapter, I want to address you about the concept of tumor angiogenesis. Nowadays, concept of tumor angiogenesis is so important. That's a very important. Drugs are there to understand their mechanism of action and how with sequencing the treatment along with the frontline chemotherapy can enhance the survival and decrease the metastasis rate is a proven fact. So myself, Major Dr. M.Q. Beg, Professor J.K. Cancer Institute, Kanpur, presenting you the concept of tumor angiogenesis. So let us talk about there are list of angiogenesis drug, that is anti-angiogenesis drug, that's bevacizumab, Avastin, thalidomide, lenalidomide, sorafenib, sunitinib, everolimus, and surprisingly doxycycline also antibiotic uh, considered as an anti-angiogenesis drug. You remember the COVID period, every doctor used to write the prescription doxycycline was not as a just a joke. It was a very serious affair because they realized in the European countries that the angiogenesis is causing the lung fibrosis and lead to the death of in the COVID, precisely the second wave in India. So that the use of doxycycline there. So we will talk you a little more about that in the subsequent slides. The basic thing is a tumor needs nutrients and oxygen to grow by the help of angiogenesis. Unless until the blood supply is not there, the tumor how can grow? The angiogenesis is the formation of a blood vessels, new blood vessels, and this process is a normal part of a growth and a healing. It is also a play important role in a several disease. Cancer is one of them. Like the bevacizumab is precisely used in the ophthalmologist for retinal, the retinal disease uh, because of its anti-angiogenesis drugs. So, what happens in the normal cells and the cancer cells? The cancer cells release the chemical messengers, and then chemical messengers lead to the formation of blood vessels, and these are blood vessels. You see the figure, the cancer cells is small and it develops new blood vessels and then grow itself more and more. So this picture is depicts that. The approval of several anti-angiogenesis drugs for a systemic therapy for several malignancies has been developed so far, and bevacizumab, a humanized monoclonal antibody against vascular endothelial growth factor, is one of them. The success of bevacizumab in combination with the chemotherapy in metastatic breast cancer and metastatic colorectal cancer is well established. And alone a single agent bevacizumab in case of metastatic renal cancer is approved till date. So what happens basically, the tumors secrete vasculoendothelial growth factors. There are several factors, and among the vasculoendothelial growth factor is one. And after the secretion of a growth factors, a new blood vascular formations there, and then the tumor increase its size and remain progress, and then further lead to the metastasis, invasion, everything. That's basically the steps. Basically, the anti-angiogenesis concept began with a landmark article published in 1971 in the New England Journal of Medicine by Dr. Folksman, and then content of publication, I'll be giving you the silent features of that publication. Actually, he presented so many paper. In 1995, he said the clinical application of research on angiogenesis, which again was published in the New England Journal of Medicine, and then the tumor angiogenesis and metastasis correlation in invasive breast carcinoma. That's the second article. So, I mean, he did a plethora of work on the angiogenesis, this Dr. Folkman. Dr. Folkman reports of a silent feature which I was telling you. What was that? First, the solid tumor will not grow beyond 2 millimeter in size unless they induce and sustain a new blood supply to provide the oxygen and nutrients for their growth of tumor mass. But up to 2 millimeter size, tumor may derive its oxygen and nutrients by passive diffusion. I mean, the nearby passive diffusion, if a tumor is derived its blood supply and oxygen, when the tumor size of a tumor is less than 2 millimeter, then I mean, we don't require a angiogenesis phenomena to happen. So let us also clarify. We use the term the micrometastasis and macrometastasis. What is micro and macro? The micrometastasis, that the tumor which is less than 2 millimeter size, is considered to be micrometastasis, and beyond the 2 millimeter size is considered the macrometastasis. When the tumor cells population begins, it produces the tumor angiogenesis factor, that is TAF, which creates a mobilization of endothelial cells of pre-existing blood vessels. I mean, the nearby healthy blood vessels which was already present, the mobilization of endothelial cells from them, and these endothelial cells begin to migrate, divide, and form a tubular structure to form a new blood vessels. So these blood vessels infiltrate into the tumor mass to establish a new blood supply for the progress of the tumor growth. The fourth point was in that his article was the administration of anti-angiogenesis agent. For example, anti-TAF, tumor angiogenesis factor, specifically neutralizing the antibodies will block the tumor angiogenesis process. But important point, the such tumor shrinkage would never be complete because of microscopic tumor which size, I have already told you, 2 millimeter or less, can survive without new blood vessels. Why? Because of passive diffusion. So this type of a therapy never be called as a curative treatment. When I say the bevacizumab adding in a chemotherapy can work up to the tumor up to the 2 millimeter size, not beyond that, because the tumor which is less than 2 millimeter size will derive its blood supply by the passive diffusion. It does not depend upon the angiogenesis to happen. Dr. Folkmans further described in his report the nature of angiogenic switch present in the tumor itself. First stimulator of angiogenesis are the basic fibroblastic growth factor, and the second, several endogenous anti-angiogenesis inhibitors are also there. The certain angiogenic drug seems to have no clinical benefit when used as a monotherapy, but has a good role when it is combined with a chemotherapy drug. That was also in his report, and in an article. In addition to stimulation of angiogenesis process, there are a number of endogenous anti-angiogenesis factor. Down-regulatory effect on them can lead to the progress of tumor. The angiogenesis can also contribute in the growth of a liquid tumor. I mean, like not even solid tumor, it is as well as effective in hematological malignancies like lymphoma, leukemias, like cytokines by activated endothelial cells at a newly formed blood vessel site, as well as the bone marrow, which promotes the survival and growth of tumor cell population. There are no single tumor angiogenesis factor, rather a large number of molecules involved in the angiogenesis process. The process of formation of a new blood vessels, how it forms, there is a number of sequential events involved in the development of new capillary blood vessels ongoing tumor mass. The first step is the formation of a new blood vessel is the breaking the basement membrane of a parent venule, that is the pre-existing small blood vessels. Now after the breakage of a basement membrane, that creates the movement of endothelial cells towards the adjacent tumor cells. This process is stimulated by pro-angiogenesis factor secreted by tumor cell mass. These pro-angiogenic factors known as a matrix metalloproteinase like urokinase, plasminogen activated factors, they are basically a proteolysis enzyme. They help in the formation of a new blood vessels. The philosophy of above two enzyme pro-angiogenic factors like the plasminogen gene activated and urokinase factor lead to a research further. Can this drug can be utilized in the oncology, because this drug which inhibits the such enzyme. The second step of the formation of blood vessel is the migration of endothelial cells as well as its division of these mature endothelial cells adjacent to tumor mass, and finally formation of a new basement membrane of a joined blood vessels. The third step is these angiogenic blood vessels of a tumor cell establish further growth of a tumor cells population. Apart from this, some endothelial progenitor cells formed from the bone marrow through the blood circulation. They reach to the area of angiogenesis and then help formation of these things. So you can link that the angiogenesis is not a local phenomena; it's a systemic phenomena, because the bone marrow is supplying the progenitor cells in helping in the formation of angiogenesis. The progenitors reach the tumor cell mass to stimulate the division of mature endothelial cells in order to form the new blood vessels. So you see here the steps of angiogenesis in metastasis, like what are the factors? The fibroblastic growth factor, angiopoietin, vasculoendothelial growth factor, and epidermal growth factor. These angiogenesis factors basically have a direct impact in the formation of new blood vessels and the tumor mass and the mass and a further growth and of a tumor, not only merely the tumor growth, then also responsible for the metastasis of tumors. So what is pericytes? The pericytes is a single layer of periendothelial smooth muscles which modulate the endothelial cell function and critical for the development of mature vascular network. Since the role of pericytes in helping the survival of endothelial cells, the same endothelial cells which is responsible for the formation of ultimately the new blood vessels, thus the pericytes emerge as an important therapeutic target for anti-angiogenesis drug. I mean, you have not only two targets you have, I've told you. One is the target against the vasculoendothelial growth factor, that is certainly bevacizumab. Second target is the agent against the urokinase and plasminogen activated factors. And the third is the pericytes, because it is also helping the endothelial cell survival and then its migration, so that we can use it important therapeutic agents against these pericytes as a part of anti-angiogenic therapy. So molecular mediators of tumor angiogenesis, several angiogenic growth factors found which modulate the tumor angiogenesis. One is directly acting angiogenic factors, second is indirectly acting growth factors. Directly acting of factors includes vasculoendothelial growth factor, include tyrosine kinase, angiopoietin, and Notch signaling receptor, especially Notch4, There is a notch. What is Notch4 basically is a transmembrane receptor and has a variety in among the Notch4 is responsible for angiogenesis. These are the direct acting factors directly involved in this tumor angiogenesis. And these all factors have a high degree of specificity for endothelial cells associated neovascularization. The vascular endothelial growth factor, which is very, very important here, the another name of this vascular endothelial factor, we say the VPF, vascular permeability factor. Vascular endothelial growth factor produced by the primary tumor cells, macrophages, platelet cells, and vascular endothelial growth factor also play a role in a normal physiological functions such as bone marrow formation, hemopoiesis, wound healing. Vascular endothelial growth factor not only limited to solid tumor but is also involved in the hematological malignancies like leukemia and lymphoma. So what are the types of vascular endothelial growth factors? We have a vascular endothelial growth factor type 1, type 2, type 3. Out of that, vascular endothelial growth factor type 1 and type 2 regulate angiogenesis, and vascular endothelial growth factor 3 regulate the lymph angiogenesis. I mean the lymphatic vessels, the neovascularization is done by the vascular endothelial growth factor 3, and a 1 is directly responsible for the blood vessels, angiogenesis. The vascular endothelial growth factor is a protein with a vascular permeability that is secreted by the tumor cells. So the Notch4, what is Notch4? Is basically a transmembrane receptor expressed primarily on the endothelial cells of blood vessels. So I have told you regarding the directly acting the factors responsible for angiogenesis. There are factors which are indirectly acting and they amplify the angiogenic process. Are first is the alpha tumor necrosis factor, beta tumor necrosis factor, transforming growth factor, inflammatory cytokines such as interleukin 6, interleukin 8, granulocyte stimulating factor, platelet derived growth factor, estrogen, androgen hormone as well, and vascular endothelial growth factor was discovered in 1989 and replaced to be highly specific and a potent mitogen for a vascular endothelial growth endothelial cells. So these are the list of indirectly acting agents. So you see here the factor which promote the endogenesis like 5-HT and the tube formation. You see here the factors which are responsible, the several MTOR, AKT, PI, 3K, SRC, P38, and then this fact through the help of these factors, the new blood vessels is being formed. There are check and balances as well. So there are 4 roles of vascular endothelial growth factor by which it promotes the tumor angiogenesis. First, it stimulates the endothelial cell division. Second, induce endothelial cell migration. Endothelial growth migration is what? Is basically the pre-existing venule. Endothelial basement membrane is breakage and an endothelial cells has to be migrated to the tumor cell mass for the formation of new blood vessels, which I have already explained you. The third is an enhanced endothelial cell survival. And a fourth factor is mobilize endothelial progenitor cells from bone marrow to the site of tumorogenesis. These are the role of vascular endothelial growth factor. The elevated expression of vascular endothelial growth factor commonly associated with the tumor hypoxia. So hypoxia in the tumor cell lead to the overexpression of vascular endothelial growth factor, thus lead to neovascularization of tumor cell mass. But there are factors which inhibit the angiogenesis, endogenous inhibitors of tumor angiogenesis. So what are these factors? The first inhibitor is a large glycoprotein molecule present in the extracellular matrix named thrombospondin 1 is an anti-angiogenic factor, and the P53 gene was found to regulate the thrombospondin 1 loss of p53 gene associated with the downregulation of thrombospondin 1 expression, so that you connect the genetic level, how it is responsible for the inhibition of angiogenesis as a part of a host defense system which developed the cancer. The second inhibitor is vasoinhibin, as a protein which is secreted by the endothelial cells as a stimulation of angiogenic factors. The biology of endogenous angiogenesis inhibitor is that they may be induced by other cancer therapy to have added effect. For examples of anti-angiogenic treatment strategies such as low-dose metronomic chemotherapy as well as doxycycline are known to induce the level of thrombospondin 1. So low-dose metronomic chemotherapy and doxycycline both have an anti-angiogenic effect. So it was seen in the COVID on the lung biopsy that there is a neovascularization in the alveoli and leading to cause of a death, and not responding the patient with even putting on the ventilator, because it is some part of like a interstitial lung disease. So that why from Europe the people start writing the doxycycline, and that was seeped up to the level of across the border and reach here in India. The people started prescribing a doxycycline as a part of a treatment regime in the corona, in the COVID-19, especially in the second wave. The strategy for development of anti-angiogenic drugs, most obvious strategy would be development of a drug that neutralizes the pro-angiogenic growth factors such as vasculoendothelial growth factor. All approved anti-angiogenic drugs either block the vasculoendothelial growth factor or vasculoendothelial growth factor tyrosine kinase receptor. Example of a bevacizumab drug developed to neutralize the vasculoendothelial growth factor. So here you see in this vasculoendothelial growth factor therapy, the bevacizumab, the blood vessels remodeling is there, and then a seizing of a blood vessels, no formation of a new blood vessels lead to the tumor shrinkage because of hypoxic and a nutrient supply damage. So that lead to that halt the process of tumor progression. In addition to the antibody protein therapy, a large number of small molecule and a receptor tyrosine kinase inhibitors have been developed to block vasculoendothelial receptor phosphorylation. Such as other drugs like sunitinib, sorafenib, these drugs' action is not only inhibition of angiogenesis, but will also have a directly acting as an inhibition of tumor cells. So they have a bi-edged weapon. They as anti-tumor effect as well as the anti-angiogenesis effect. So bevacizumab, when you use alone, effective, when used along with the chemotherapy, they have a proven good results that I have already explained. Other mode of a treatment, those having anti-angiogenic effect, example radiation treatment, is also have an anti-angiogenic effect. The cetuximab, trastuzumab targeting HER2 antibody do have a down-regulatory effect on vascular endothelial growth factor and up-regulatory effect of thrombospondin 1. The down-regulatory effect on the vascular endothelial growth factor, that means they will is basically directly down-regulatory effect on the new blood vascular formation. So how anti-angiogenic drugs enhance the effect of radiation therapy and chemotherapy both? Anti-angiogenic drugs actually increase the tumor oxygenation and blood supply, thus increase the intratumoral level of chemotherapy as well as enhance the oxygen level, also increase the effect of radiotherapy. But how effect of radiotherapy is increased? Because these anti-angiogenic drugs pre-existing venule or artery vessels, the breaking of basement membrane and endothelial cells mobilization is stopped so that vessels remain healthy, so that the vessels supplying directly to the tumor cells is basically intact because of this therapy, radiation and chemotherapy, so that the tumor achieve the maximum dose of chemotherapy and a radiation effect. Because the oxygen is reaching normally to that tumor cells. So markers of tumor angiogenesis, possible marker of tumor angiogenesis are circulatory blood protein, that is vasculoendothelial growth factor, proangiogenic growth factor, circulatory endothelial progenitor cells. So what are the biomarkers? The elevated level of vasculoendothelial growth factor are associated with a poor prognosis. Thus, the high level of vasculoendothelial growth factor, bevacizumab treatment would be more helpful. The vasculoendothelial growth receptor diagnosis and test required a tissue specimen, the immunohistochemistry study, but the tissue specimen must be from the primary tumor site, usually not from the tumor metastatic sites. What are the benefits of anti-angiogenic therapy? It inhibits the new blood vessel growth in the tumor tissue, blockage of development of endothelial progenitor cells, normalization of vasculature, thus decrease the permeability and increase the chemotherapy drug dose delivery to the tumor tissue, direct effect as an anti-tumor effect on the tumor, inhibition of a damage of endothelial cells by chemotherapy drugs, and as well as have an immunomodulatory effect. For the tumor other than renal cell carcinoma, anti-VEGF therapy only provide benefit when it is given in combination with chemotherapy. And tyrosine kinase inhibitor in metastatic colorectal cancer enhance this effect when it is given with a chemotherapy like metastatic breast cancer. Bevacizumab augment the effect of paclitaxel based chemotherapy. So let us talk about what are the side effects of the toxicity profile of anti-vasculoendothelial growth factor therapy. Hypertension is one of the factor, proteinuria, bowel perforation, thrombotic events, so that the proper cardiac and renal checkup has to be there. Why hypertension is occur? Hypertension do occur because anti-vascular endothelial growth factor cause inhibition of endothelial cells derived nitric oxide, which is known as the vasodilator. So when it stops, the vasospasm and then lead to the hypertension. Why cause proteinuria? Because it causes damage to vascular endothelial cells. This bevacizumab cause proteinuria because it causes damage to vascular endothelial cells of a glomeruli, which lead to the proteinuria. There is also gastrointestinal perforation happens 1.5 to 5.5 patients receiving the bevacizumab therapy because it caused the GI ulceration, which further lead to the GI perforation. Bevacizumab induced vascular endothelial growth factor inhibition, which result in the cholesterol emboli syndrome (CES). What are cholesterol emboli syndrome? Is basically have patient having hypertension, GI perforation, eosinophilia, which lead to the mesenteric vessel ischemia, and which further lead to the GI perforation. Good luck and thank you for your kind attention.